Did you know you can drive with a visual impairment? But what does visual impairment really mean, and how is that different from legal blindness? Or is blindness preventable? There are so many more different underlying causes to blindness than you might think. We'll be talking about all that and more coming up. There are so many different causes of blindness, some age-related, some genetic, some congenital, some traumatic. Some are even caused by lack of proper vision care or vision correction at a young age, which you can learn all about here. Some types of blindness are stable and some are progressive. It's not always easy to see that someone's blind from the outside. In some cases, it might be more obvious, like if there's been trauma or there's visible scarring. And some might be more subtle, like in the case of nystagmus, where the eyes seem to be shaking a little bit. And that's because in someone with low vision, their eyes are kind of searching for something to focus on, but when you don't have clear vision, the eyes aren't able to find that stimulus or that focal point that helps to keep them steady. And in other cases, for people with low vision, you might not be able to tell from the outside that they have low vision at all. So it's always important to be kind, aware, and patient with others because some disabilities are invisible, and blindness and visual impairments are an example of that. Since there are so many different causes of blindness, including genetic and congenital causes, blindness really can affect anyone at any age, and it's not always clear that someone is blind or visually impaired. Not everyone uses a guide dog or a guide cane or needs to use Braille in order to read. There are a lot of different ways to be blind, which I'll be discussing. According to the World Health Organization, over 250 million people around the world are visually impaired, and 36 million of them are considered blind. It's a common misconception that people think blindness means no vision or everything is dark, nothing at all. And there is a term for that called NLP, or no light perception, but that's not always the case. There's a whole range of visual impairments that are defined by a couple of different things. And that is visual acuity, your ability to read the eye chart, and visual field, or your peripheral vision. These definitions vary a little bit depending on who you ask, but generally speaking, visual acuity of 2200 or worse in the better seeing eye with best vision correction would qualify someone as legally blind. So if someone says, I'm legally blind without my glasses, that's actually an oxymoron, and it's just not true. You can also qualify as legally blind if you have excellent central vision, but a large loss of peripheral vision. Our normal peripheral vision is around 180 degrees horizontally and 135 degrees vertically. And to qualify as legally blind, the visual field would be 20 degrees or less. And according to some definitions, 10 degrees or less. There is also a term called low vision, where the vision in the better seeing eye with best visual correction is between 20/70 and 20/100, though the American Academy of Ophthalmology says vision of 20/40 or worse. These definitions help determine regulations when it comes to driving, and the United States government uses them to determine eligibility for rehabilitation, disability benefits, low vision devices, and tax exemptions, among other things. Speaking of driving, there are ways for people with low vision to maintain this level of independence with specialty glasses called bioptics. These allow people to see through the main part of the lens for nearer objects and with a slight tilt of the head to look through the top telescope to read signs or things that are further away. Laws about visual acuity and visual field requirements can vary by state, and it may be difficult in some places to find low vision specialists or vision rehabilitation specialists who fit these types of glasses, but they are out there. There are ways to correct vision creatively outside of glasses and contacts that can be utilized by people with low vision or legal blindness. Low vision or vision rehabilitation specialists are optometrists and ophthalmologists who specialize in matching blind or visually impaired patients with devices that suit their needs best. And these devices could range from magnifying glasses, wearable devices, electronic devices, among other things that help to maximize the vision that remains. If you learned something new today, please like and subscribe. There are many causes of blindness worldwide that are treatable or preventable. An example would be blindness due to uncorrected vision. Now, we just talked about that blindness means your visual acuity is a certain way with your glasses on. But what if you live in an underserved area and you don't have access to glasses to begin with? Well, this is considered a cause of blindness, and it could be preventable if someone just had access to care. Another is cataracts, and they are treatable with surgery, but not everyone has access. There are a lot of volunteer organizations out there that are aiming to change that. I've worked with a few of them: SVOSH, VOSH, TWEX, Rotary International, and Unite for Sight. So if you're looking for someone to support, I would recommend one of those organizations to help those with vision needs. Amblyopia due to lack of early eye care interventions or anything related to trauma or infection. Another example of this is trachoma, which is a leading cause of preventable blindness worldwide. It largely affects those in underserved areas, living with poor sanitation and in crowded conditions. So you can imagine what could be done if care was available to these areas, because trachoma has been eliminated in developed countries. If you've been paying much attention to the news lately, you might be wondering, well, what about an eye transplant to cure or treat blindness? There has been a case where there was a whole eye transplanted. That means the whole eyeball and optic nerve were transplanted. And so far, that eye is surviving. However, the eye does not yet have vision. So I'm going to be making a video about this eye transplant and what that could mean for the future of eye care. So be sure to subscribe so you don't miss out. Do you have any questions about blindness that I didn't cover? Comment below and I'll try to answer in a future video. Thank you for watching, and I'll see you next time.